And make sure you get her whatever handout.
Okay.
Mosquito. 1, 2, 3, 4, 5, 6.
Yeah.
Okay.
Proper care and handling of electrosurgical equipment, also known as ESU, is essential to patient and personal safety. Electrosurgery is used routinely to cut and coagulate body tissue with high radio frequency current. Maintenance and safety inspections on all ESU equipment should be done routinely. The ESU consists of a variety of tips. We have ball, loop, long tips, some have even protected tips. And then there's the handpiece, which consists of 2 buttons. One is to cut, the other one is to coagulate. Then we have the cord, which connects to the ESU apparatus. This machine is what powers the ESU to function. The ESU, dispersive electrode, and the active electrode should be used accordingly to the manufacturer's instructions. If you ever have any questions, refer to the equipment manual, which assists with operational, safety, and maintenance guidelines. A ESU that is not working properly or is damaged should be removed from service and tagged and reported to biomedical services to ensure it is in good that it's in good working order.
When using the ESU, it is hooked up to a wall outlet. Before plugging in the cord, you have to check for any kinks, knots, or tangles and untangle them, unhook them before plugging into the wall. Also check your cord for any breaks in integrity or any fraying of the wires, which could cause an electrical fire or shock to personnel, even patients. When plugging in the ESU plug from the machine, you must make sure it fits properly and it is laying on the ground flat. You do not want to have it up hanging tightly to the wall because someone could trip. Also, you have to have adequate length from the ESU machine to the wall so there is no tension. One, tension can cause somebody to trip again, or tension can also cause the wires to fray at the plug like this, how it is, or it could cause disconnection and there would be no ESU electrical charge to the field. Once using the ESU, before setting up the case, the sterile person would set the ESU, place it through the plastic holding case, and attach it to the field with a sticky pad or a clamp. This plastic holder keeps the ESU from burning the patient because the ESU tip, the electrode, can get very hot and can cause a burn to the patient, catch fire to the drapes, and injure the surgeon or the scrub tech. The ESU handpiece has to have adequate length from the ESU machine to the sterile field. Once using the ESU and placing it through the plastic holder, you must have adequate length from the holder to the operating site. The operating site may differ and the placement of the holder may differ depending on where the surgical site is. When turning your machine on, the circulator, a non-sterile person, will turn on the machine and the power of the setting should be verbally said by the surgeon and the circulator. This power is what powers the coagulation and the cutting of the ESU. You must be very careful to not dropping the ESU, because when you drop the ESU below waist level, it is unsterile. Even though it is hooked to the plastic container, it still is contaminated if it falls. All you would do is replace the ESU. The sterile technician would get a new ESU dropped onto the field by the circulator, and the circulator would reconnect it. This happens often, so be sure to keep an eye on your ESU when the surgeon's using it, where he places it for fires, and how it can fall. You want to make sure it's never contaminated, never hot and on the patient, or burning drapes. And keep away from oxygen because oxygen tends to pool underneath the drapes and can cause a very rapid fire. And this is the end of our electrical safety on the electrical surgery equipment.
So, by following safety precautions of the ESU, it prevents injury to the patient and the personnel.